Good day. Welcome to Living Well in Montana. This is a program of LIFTT, which is a federally funded program in Montana that helps people with disabilities. LIFTT stands for Living Independently for Today and Tomorrow. I'm Corby Skinner, the program host, along with my partner in crime, Kathleen Benoit. And today we are going to talk about various components of the Americans with Disabilities Act.
We are so pleased to be working with an expert in the field talking about Americans with Disabilities Act, Dr.
Paula.
I'm sorry, Dr. I almost called you Paulie. Dr. Paula McMahon, who is the assistant professor with the MSUB Rehabilitation Program. We had a wonderful Chapter 1 on your presentation, and so we want to jump right into it and talk about the consequences, talk about the successes and the failures that have occurred with the Americans with Disabilities Act and what your role is in it.
So specifically today I'm going to dive a little bit into the different titles of the Americans with Disabilities Act and kind of how they work. And I'm just going to do kind of a quick overview. There's 5 titles. The first one addresses employment. The second one, Title II, addresses public entities, county and municipal programs and facilities. Title III looks at privately owned public accommodations. Title IV looks at telecommunications. And Title V is kind of the miscellaneous catch-all, for want of a better way of putting it. And so first, it's worth talking about how disability is defined by the Americans with Disabilities Act, being mindful of the fact that as the ADA Amendments Act of 2008 expanded what the expectations are with regards to this. And so if somebody has a physical, mental, or impairment which substantially limits one or more major life activities, including like walking, seeing, hearing, speaking, breathing, but it could be something as simple as I sit at my desk for long periods of time and I have such significant back pain that I'm seeing a doctor, I've seen a medical specialist, and I now need a standing desk because I cannot sit at my desk for a long period of time. So being mindful of the fact that the language behind the ADA definition of disability is expansive in terms of how they view it. And then the second prong is having a record of such an impairment. And an example might be where somebody hasn't specifically initiated an accommodation process or made a request with regards to concerns, but has, for example, in an employment circumstance, filed paperwork to take a medical leave under the Family Medical Leave Act. So paperwork is on file indicating that somebody, say, for example, has cancer. They've taken leave of absence at work and they've come back to work. They haven't initiated an accommodation process, but it is known that they have a health issue.
And Paula, let me interject here because it's one of the things that LIFTT, the program, can really help people do.
You took the words out of my mouth. That's true.
People may have a disability, whether it's a physical, mental, any kind of disability, but LIFTT will help you make sure that you keep track of the paperwork and you have all the various parts to then move forward.
Excellent point.
Absolutely. And then the third prong of protection is regarded as having such an impairment. And so you may have someone who hasn't identified as having a disability but uses a cane, has a walker, for example, and so they haven't needed to specifically request an accommodation or ask for access to a facility, but they fall under that regarded as prong because even if they haven't identified, you know, that there's a way of identifying that they have a disability. So, okay. And so just being mindful of the fact that the context for disability is as broad as possible. And I think that's really important, kind of like as you indicated in that K through 12 environment, learning disabilities, considering the fact that there are invisible disabilities that people might not immediately understand or construe, still falls under that umbrella. You know, mental health concerns, but it could be something like dyslexia or dysgraphia, as well as mobility disabilities and other areas of life that are impacted. If somebody has a breathing issue, if they have gastrointestinal concerns, if they're seeing a medical professional who is assisting them in navigating that process, they have the ability to create paperwork that identifies them as having a disability that falls under that broader spectrum.
And again, it sounds daunting, and that's why there's organizations like LIFTT, and you being on the board, it navigates. The staff is well trained. It doesn't seem so hopeless when you have somebody kind of helping you through that maze.
Well, LIFTT provides also opportunities for advocacy, and so what they do is do a lot of advocacy training for individuals with disability, and so if you want to be able to connect with that organization, they actually, one of their specific service prongs is to provide self-advocacy training for individuals who are looking to navigate getting back into the community or into employment, or if there's a concern that they have with access. You know, they will provide them with some of the tools that they need to kind of navigate that self-advocacy component. And they can also connect them with community resources around the state that can assist them with that as well. So, first I'll get into a little bit into the Title I of the ADA, which is specific to employment. And they have 3 categories of accommodations. They look at the application process, so the application process should be readily accessible. And there have been challenges to this in terms of now we have a lot of online applications, and making sure that those are readily accessible to people who have a variety of processing disabilities, dyslexia, dysgraphia, or people who are blind and visually impaired. And you'll see that there's a variety of legal cases pertaining to that. The second prong is performance of the essential functions of the position. And so an individual needs to be able to complete the functions that are outlined in the job description with or without accommodations, but basically you need to look at the job description. And so it's really important for employers to consider how they define what a job is. You can't then turn around, say 6 months later, and say, oh, this is an essential job function, and it isn't something you defined in the expectations for the position.
Know what you're getting into.
Absolutely.
Both as the employer and the employee.
Yep, absolutely. And then the third prong is enjoying equal benefits and privileges. And so that is if your organization offers benefits and opportunities, but the example I always give that's simplest is if there's a break room, it should be accessible. If that's where everybody microwaves and eats lunch, that should be something that everybody gets to use. So that kind of gives you a more concrete idea. Thinking about essential functions, basically it's really making sure that people understand what the expectations are. One of the things that I found challenging when I worked as an Americans with Disabilities Act coordinator is sometimes graduate job assistance positions would be like a paragraph, and they would have very non-specific guidance, you know, mainly because a lot of graduate assistants work as catch-all, you know, you catch everything that, you know, we don't have. There isn't always ideas because there's different grants going on, there's different research opportunities occurring, and so sometimes they can be intentionally vague because they're going to kind of develop the job as the graduate assistant is there. And so it became really important to kind of really think about how do we write language to make sure that we can then also effectively accommodate somebody and help them navigate the expectations of the position. Okay. And so the other thing to think about is requesting reasonable accommodations under that Title I prong. And basically that's a change to the work environment, but it doesn't have to be significant, but it allows somebody with a disability to effectively accomplish the expectations of their position.
So again, it could be as simple as the room needs to be wide enough for a wheelchair to get in. That would seem to be a fairly reasonable accommodation.
Yeah, but also it could be like read out loud software on a computer. So if somebody has neuromuscular concerns and they're no longer able to access a keyboard, you may utilize things like read out loud software for them to be able to do their work. It can be parking. You know, it can be anywhere from, you know, when they enter into the building and they go up to a second floor, is their desk accessible? Is the equipment that they're utilizing allowing them to be able to effectively navigate their job? But really the objective is equal employment opportunity, that they have access to the same opportunities as anyone else to be able to then do the essential functions of the job. It doesn't change the job description, so that's worth understanding. It fundamentally looks at what can we do, and you know, certainly when I worked as an ADA ADA coordinator, a lot of the time supervisors would want to collaborate, want to understand, and in my experience the majority of accommodations are fairly low cost. They're not prohibitive, it's just really understanding how to be able to be creative in navigating, identifying opportunities.
So another thing I would like to point out is that LIFTT is also very helpful for employers. If they are concerned about, we might have some jobs that would be appropriate, and so they can call LIFTT to make sure that all of Title I accommodations are there.
Yeah.
So Title II.
Okay, so Title II, well actually I'm going to quickly talk a little bit about accommodation basics. It's really worth understanding in employment circumstances. It has to be effective, but it doesn't have to be the best accommodation. It just has to allow them to do their job effectively. And it must reduce employment-related barriers. If you don't identify as, if you don't say, there's no bright line language that says, I need an accommodation, but you do need to say, for example, I'm really having trouble, I'm really having issues with lifting boxes right now, my back's in a lot of pain. That actually could initiate the accommodation process. And employers need to be cognizant of that. There is no bright line language that says, you have to say, I need an accommodation, can we start that process? And so employers do have to be sensitive to the fact that if an employee identifies that they have a health concern and that they need help with a function of the job, that can initiate that process in essence. And so an employer is not prevented from providing extra accommodations. I've often worked with supervisors who are willing to, they know what their environment is, they know what resources they have, and they can identify things. Sorry about that.
Yeah,
now,
well, that's important to know.
It's really important.
This program is for everyone.
Yes, much like the services that LIFTT provides, they do, yeah. And so Title II basically looks at a summer camp. So if a summer camp offers lessons to students, that a summer camp needs to be readily accessible to students with disabilities. You can't offer an alternate program that's just for students with disabilities. It needs to be accessible for everyone. Organizations such as this one needs to look at creating opportunities for accessibility for individuals with disabilities. And so services must be provided in an integrated setting unless separate or different measures are necessary to ensure equal opportunity. And so a lot of higher education facilities fall under the prong of Title II if they're publicly funded. And an example I would always give is if you were advising a student and you were in an old building that was not readily accessible and you provided advising to all of your students face-to-face, then you needed to move your advising to a different. It wouldn't be that you wouldn't provide them with advising, but it might be that you're like, let's go meet in the library, which is accessible, and I'm going to provide you the same equal access to advising in the library as I would any other student.
And I think the key word throughout all this is equal access.
Yes, exactly.
It's equal access for all.
Yeah, and then the second part of it is furnishing auxiliary aids and services when necessary to ensure effective communication unless an undue burden or fundamental alteration would result. Being mindful of the fact that if you're an organization that has significant resources and funds, you really will not necessarily be able to utilize undue burden or fundamental alteration as an issue of concern. Like if you're a mom and pop sandwich shop, you may be able to show and demonstrate that you don't have the resources and funds to be able to provide equal access. But if you're a franchise, you are going to have to navigate providing accommodations. And that's the example I use under kind of the public thing, but that gives you a sense of what the resources and expectations are. Okay, so basically, public entities need to adjust their policies, practices, and language. They can't use eligibility requirements that screen out people with disabilities. There may be programs that they have fundamental concerns with, but they're going to be able to have to. I think rarely is there going to be a circumstance where in a public entity it says that they can't appropriately accommodate somebody with a disability, and so they need to be thoughtful about that.
And again, just to point out, LIFTT can help.
Yes, absolutely.
The business owners, the corporations, they're not adrift, because
Yes.
that's one of the things that we've mentioned before. LIFTT can help with those requirements.
And so the example I gave here is like a community college student can't be, who's utilizing a wheelchair, can't be refused being enrolled in a pharmacy class, because what they need to do is look at programmatic access. And when you are looking at under Title II, you are determining, can you provide programmatic access to a student with a disability? You are not evaluating under the Title I prong, will an employer employ them? That's the employer's responsibility to navigate that. Under Title II, your responsibility as a summer camp, as an organization that provides, you know, community-based services to individuals with disabilities, can you afford them programmatic access?
Access is really the...
Yeah, exactly. So, looking at the kind of auxiliary aids component of that, you need to be able to furnish auxiliary aids and services when available to provide equal opportunity. This particularly applies in like higher education environments where you may have interpreters, you may use like CART services that provides captioning information for students or
hearing aids.
Yes. Now, a hearing aid is actually slightly different in the sense that typically a hearing aid is something that you will provide yourself. Now, under the Americans with Disabilities Act, even if you have a hearing aid, that doesn't change your definition of your disability in the sense that it doesn't ameliorate it, but you can provide other services. So typically a hearing aid is something that, because only you can utilize it, because often it's changed programmatically to meet your needs, that is something that typically you would furnish for yourself. But if you were having trouble with hearing, you might have like a system that's put into a classroom so that you can use your hearing aid to tune in to that system.
I was just thinking at the theater, at the Alberta Bear Theater, we have a system where people can program the hearing aid to hear the program
hearing
better.
devices, what they call
exactly. So that's that's a perfect example of where that accommodation comes into play, is in a circumstance like that.
I am amazed at the thoroughness of each of these acts. I mean, it's like you have considered every single possibility that needs to be covered, and
it's not as comprehensive as I think people in the disability community would like it to be, in the sense that sometimes there's case law, because often how ADA cases are decided is passed out through case law and judicial cases, and so often how judges interpret the Americans with Disabilities Act can often then play out as to how that it's effectively utilized. And to be honest, it's been more progressive as of late, partially as a consequence of the revisions and with the Amendments Act, but it's still, you know, it's comprehensive, but you know, there's
more.
Yeah. There's always more that needs to be done with regards to creating advocacy and opportunity for people with disabilities, from my perspective. But I agree, it's really a good baseline. So say, for example, in a higher education setting, a college is not required to change its academic standards. And so say, for example, if a summer camp said, these are the activities we're going to do in the summer camp, and somebody said, well, my kid can't do them, so now you can't do them. They're not required to change how the service is offered and what the essential content of the service is. And that's worth being understood with regards to, you know, the expectations. So a college, you know, if I teach a class as a professor, I'm not required to change the assignments I have due, when they're due, or if I have discussion boards, I don't change my expectations around that. But what I do make sure is that if I, for example, put any papers in, students can read them. That they're in an accessible format, that kind of information. So yeah.
I've run across that teaching college, but it's always the students that somehow aren't doing the work. It's not an issue of accommodation.
No, it's not an issue of accommodations, then. Especially at the undergrad level sometimes.
So Title III talks more about commercial and public businesses, right?
That is correct. So basically Title III really looks at kind of that thing I was mentioning earlier about stores. Basically, if they have if they operate lease places to the public accommodation, if they're a commercial facility, private entities that offer certain examinations and courses. So say, for example, coming to college, you might be doing an ACT test in a building. Or if you're doing different types of exams for licensure in different areas, or if it could be plumbing, it could be electricians. It's not necessarily specifically to higher education, but you need to be able to make sure that you're doing this in environments that are accessible, be it online or physically, to individuals with disabilities. But it also sets a standard for expectations of access, and so this is where a lot of that kind of architectural access will come into play, in terms of, you know, is there adequate parking, is there adequate bathrooms, are people able to have that same experience? So if you go into a store, you know, we all want to be able to go into a store and try on the clothes before we buy them. You know, and then, you know, if you go into a grocery store and there's things that are up really high and you can't reach them, you know, I don't know if you've ever experienced it. I certainly have experienced going up onto a top shelf and having to try and balance myself to try and pull something down.
Me too.
Yeah, and I'm tall.
I'm short.
And so these are things worth considering. There are considerations around that as pertains to Title III of the Americans with Disabilities Act. But we've all seen in play, just like we both said, that isn't necessarily always readily identified when you navigate
That's right.
a place that this applies to.
And again, businesses, if they're concerned about that, could contact LIFTT, and they have people that will go out and sort of assess a building or a store to just think about it differently and make the accommodations more accessible.
Yep, and you'll find that there are a lot of stores, like some of the bigger chains, that have identified they'll have staff available, they'll create opportunities, they'll have, you know, carts available for you to be able to navigate effectively those environments. But you're right, there are often a variety of ways that public organizations, not organizations, public entities private entities, that's the word I'm looking for, sorry. Private entities can identify ways to provide accommodations and navigate the environment that they're in while still effectively allowing some access for individuals with disabilities.
And how do you think our community is doing in terms of providing physical accessibilities?
I think that the community does a reasonably good job. I have been to cities where the accommodations offered are pretty outstanding. Interestingly enough, in Texas, I went to Texas, and their community is super accessible. In San Antonio.
San Francisco?
San Antonio, I haven't been to San Francisco, but San Antonio and interestingly enough, where was the Alamo?
In
Houston.
San Antonio.
San Antonio, yeah. Oh, it is in San Antonio. There's two places I've been to in Texas that were fairly readily accessible. Denver is a fairly ADA compliant city. So it's really like, you have to think about all disabilities, and Billings has done a pretty good job, but like if you're blind or visually impaired, if you're in a wheelchair, if you have a mobility issue, there are a variety of different concerns that you're going to navigate. You know, or if you're somebody with a learning disability, and I do think our community does do a good job of working to accommodate people with disabilities. But I always think, you know, there's always room for improvement.
So, Paula, we have about 5 minutes left, and I want to talk about Title IV, which involves communication, because Kathleen and I were actually hired by LIFTT during the pandemic, because LIFTT realized how difficult it is when they're used to having people come to their office
face-to-face,
or serving people face-to-face. How do you go about communicating during a pandemic with people with disabilities?
So I will jump forward a little bit to Title IV. So Title IV specifically addresses like telecommunication relay services, and what that means is if somebody wants to communicate over the phone, that people with disabilities be afforded the opportunity to communicate effectively with their peers, but it also looks at closed captioning services. And so if you've ever been in a storm and you've seen those closed captions come up on the alert that tells you and alerts you, that was actually the thing that primarily initiated the concern regarding people in the community being able to take shelter, and then it was expanded to really address how do we provide effective communication for people with disabilities when watching a show. And I must admit that the deaf and hard of hearing community in America in this are very active, and so we'll engage with community, organizations, television services, to let them know if there are captioning concerns. And there have been recent legal cases with regards to streaming services that have really worked with them to ensure that access is afforded. I'm not going to name any streaming services here, but it really is about effective communication and allowing people to navigate that.
I don't watch a lot of TV, but during the pandemic, I realized I needed to expand my options and got a smart TV. And the first thing I noticed is all the variety of choices in terms of captioning, hearing that was available. And I mean, I can hear pretty well, but I've gotten used to having the captioning.
And a lot of people find it very useful, particularly when there's shows where there's a variety of volumes or ways of speaking. It just affords you a way to track information in a variety of different modalities. As I'm sure you know, having worked in higher education, one of the challenges can be that you're teaching people with different ways of learning effectively, and the same is true with communication. And so being able to afford people access to all of it really gives them a variety of different opportunities. So, there are people with learning disabilities who will appreciate being able to utilize closed captioning, as well as people who are blind or visually impaired, or the deaf and hard of hearing. All will utilize the read out loud that comes with captioning, or the captioning services themselves in a different variety of ways.
So are there consequences for organizations and businesses that don't fulfill ADA requirements?
Or don't comply? Is there an enforcement plan? Or
so organizations such as LIFTT are often engaged in advocacy opportunities, and so typically the ADA requires, as if we go into Title V, that any people can be sued under the Americans with Disabilities Act. It does meet. But the Americans with Disabilities Act does have an expectation that people resolve issues at the lowest level possible. And so initially, if you've identified a concern with regards to access, you need to be able to work with the television station, the private business, the Institute of Higher Education, or the community summer camp. You need to work with them first. That's the expectation. And then you need to demonstrate that there's been back and forth communication. But then you can start taking it up to different levels where you can engage with, like the EEOC, the Equal Employment Opportunity Commission. For example, if you have an employment discrimination complaint. In this state, there's Disability Rights Montana, and they will work with people who have identified disability discrimination related issues. And so there are a variety of different community advocacy organizations that can help people kind of take it up to that next level. And there is the opportunity to file a suit in a court of law, but again, the expectation is that you've demonstrated that you've worked through all of the other processes that are in place first. And the law does specify that. And then the ADA doesn't take precedence over state and local laws. So say, for example, if there's a state and local law that has a higher bar with regards to disability-related issues, that law will take precedence. And so you find in states like Florida and Arizona, they have a much higher, bar in terms of parking. Disabled parking, which reflects the population. And so that law takes precedence there.
Paula, thank you so much. There's so much information.
It's amazing. Dr. Paula McMahon, she's a LIFTT board member. She also works in the Rehabilitation Department of MSUB. Fascinating. I hope you come back. This is a wonderful, wonderful
Thank you guys for
subject.
the opportunity.
Thanks for joining us.
Yes.